Great. Let's get started. Welcome, everyone. My colleague Sophia has posted in the chat a link to the guidance that is the inspiration for this session, the kind of backbone of this session. You'll have an overview of that in just a minute, but I first want to just start by telling you who I am and welcoming you. I'm Laura Williams, the Director of Systems Advocacy at Global Rights for Women. And on behalf of our whole team at GRW, I'm really pleased to welcome you to our conversation today on safely consulting with survivors. Now, Global Rights for Women works with partners in the United States and around the world to bring societal change through legal and systems reforms to end gender-based violence. We center survivors' voices and insights in our work, and this is what makes today's topic so relevant. With the support of UN Women and Australian Aid, GRW developed a guidance document called Safe Consultations with Survivors of Violence Against Women and Girls, the link in the chat, to further develop the confidence and competence of advocates, researchers, policymakers, and other leaders, and what they need to safely engage survivors, to learn about their experiences with services and systems. Now, as we begin, it is our practice to acknowledge the Indigenous people of the lands where Global Rights for Women is headquartered. Even though we are meeting in a virtual space, it is important for us to recognize that we have and continue to benefit from the theft and occupation of this land since even before the United States was formed as a nation. Global Rights for Women is located in Minneapolis, Minnesota, in the United States, with staff throughout the state, and acknowledges we are in Dakota and Anishinaabe land. And I'd add that I'm joining you from Wakura and Paracu land in what is now known as Baja California Sur in Mexico. If you'd like to enter into the chat a land acknowledgement from where you are joining us from today, that would be most welcome. As you do that, I want to just acknowledge that we recognize that historic discrimination and violence have been inflicted upon Indigenous people globally. Additionally, we understand the treatment of Indigenous women is a byproduct of colonialism, racism, and misogyny that has perpetuated the continued sexual abuse, disappearance, and murder of Indigenous women in Minnesota and in many places around the world. In recognition of that, please join us for a moment of reflection to acknowledge the harm of the past and of the present, and to consider how you and me and each of us can join the effort to dismantle the continued oppression of Indigenous communities and to restore justice. Thank you. And now to each and all of you, we welcome your comments in the chat or in the Q&A section on Zoom. After the conversation, we'll be sending out a link with the recording. We want to welcome you and thank you for coming. We encourage conversation even while presenters are speaking. That's how we know what to make sure we address and encourage that engagement even among you as participants as well. We have a great panel with us today, have such rich and varied experiences, including leaders with whom GRW has partnered on specific projects. I'm beyond delighted and pleased to introduce them to you, and I will name them each and then have them introduce themselves one by one. And the first is Amarantini Keefe from the Domestic Abuse Project. Amarantini, can you say a few words about yourself?
Yeah, thank you for having me. My name is Amadini Keefe. I'm the Executive Director at the Domestic Abuse Project. I've been at DAP for about 5.5 years, and our organization focuses on providing therapy, case management, and advocacy services for every member of the family. And we're excited to be here to talk about focus groups.
Thank you so much. Next is Alicia Wallace from Equality Bahamas. Alicia, can I toss it to you?
Thanks, Laura. Hi, I'm Alicia from the Bahamas. I'm the director of Equality Bahamas, which focuses on ending gender-based violence, particularly focusing on women and LGBTQI+ people.
Thank you so much, Alicia. And Scott Miller of the Domestic Abuse Intervention Programs.
Hi, Scott Mahoney from the Domestic Abuse Intervention Programs. Our agency focuses on advocacy for survivors, men's nonviolence programming, and the core piece of our work is system change, mostly focused on linking government and community-based organizations in a coordinated community response to respond to this particular kind of violence.
Thank you so much, Scott. And last but never least is Melissa Skaya, my esteemed colleague at Global Rights for Women. And Melissa, as you introduce yourself, I'll turn it over to you to then do a brief overview of the information in our guidance document.
Great, thanks, Laura. Thanks, everyone. Glad that you're here with us. I'm Melissa Skaya, the Director of International Training at Global Rights for Women. In that capacity, we do work with partners around the world at an invitation to work with them to address the systemic, legal, and community response to violence against women and girls. I also co-facilitate what's known as a perpetrator program or batterers intervention program with men, and I've been doing that for the last 23 years now. And then prior to working at Global Rights for Women, I worked with Scott and was the director at the Duluth model, and then worked with survivors in an advocacy program. So welcome, everyone. Sophia has put in the chat the link, and maybe Sophia, if we could do that one more time, just for those who've maybe joined a little bit later to the guidance. One of the things I just want to say is that I'm not going to read the guidance to you. We're not going to be doing that. I'm just going to highlight some things about the guidance document to help you sort of navigate some of it. And then we're happy to have questions along the way. But just to say that, I've had the great honor and privilege to be a part of many documents to develop. And I have to say this one, I just feel particularly excited and proud about, in part for a couple of reasons. One, it's because it's something I believe so much at the core, which is that if we're going to do really good work and engage and create interventions, we actually need to talk to survivors about how we're doing or our ideas about what we want to develop. And so, and then also that we worked really hard to make it a real practical guide. We gave you examples, things you can copy and paste, make photocopies of, recreate in terms of how to do this work. But this guidance really came to be, as Laura said, through work with UN Women and Australian Aid. Through the Essential Services Package is an international guidance document. And so that international guidance document covers all the core areas: health, criminal justice, working with survivors in an organization. And that international guidance document, there were 10 countries that were given money around the world to try and implement it and to meet those guidelines. I came in at year 2 of the implementation of that and was asked to assess the processes that countries were using in their implementation of the Essential Services Package. And one of the things that came from that assessment was that a lot of countries made huge changes in their work. They made huge policy changes, practice changes, just in terms of how they reorganized their work. But unfortunately, the one thing that we did not see in any of those 10 pilot countries, none of them did any focus groups or interviews with survivors about how to do those changes and how to think about those changes. So through that assessment, then we talked to UN Women and Australian Aid about the importance of creating this document, because there are a few core reasons why people didn't, and we'll talk about that in just a moment. I want to just quickly acknowledge this is just a list. I'm not going to read this to you, but just a number of core people around the world who really influenced what we ended up putting in this guidance document. A number of those partners are here on this call. Some of these people here read drafts, others worked through the process with us. We tested out some ideas for this. So we just really want to thank the number of partners listed here around the world in terms of helping us develop this guidance document that you have in that link. So we really sort of, as Laura said, create this and want to do a survivor-centered approach. This is a sort of lingo or word, survivor-centered approach, that I believe that everybody wants to do and intends to do. And what we hope is that when you use this guidance document, you'll be even closer to really engaging with what survivors actually need and what they're saying in terms of how we develop our services and do our work. And we've seen more and more countries really talk about this, and we're really excited about that. So when we think about this, one of the things we want to make sure that we say to set the stage is that often we use the term survivor or victim, or even in a plural sense. But what we don't talk about enough is the diverse needs that survivors had and the diverse risks that survivors face around the world. So for example, our office is located in Minneapolis, and what a survivor has as a barrier to them in Minneapolis is not the same as the Philippines. I saw some of our colleagues and friends from the Philippines are joining with us here today. And so just to acknowledge that, well, yes, we've created some things, for example, in Minneapolis, we have no idea if those interventions would ever work. And we're not here to say you should replicate it. What we tell community partners is the first step we encourage you to do is to think about is to engage with survivors, or if you have an idea that you want to sort of implement, is then take it to survivors before you actually implement it, because there's a diverse experience of survivors and even in a community. So for example, if you are immigrant woman that comes from Somalia and lives in Minneapolis, your experience and your needs may not be the same as an immigrant survivor as, for example, another survivor who lives at a particular address and is not an immigrant woman and faces different barriers. So we really just want us to also challenge you to think about the importance of what we're saying to do is because of the diverse needs that survivors have. So when we looked at and talked to countries around the world, in those 10 pilot countries and other communities, there were two key reasons why communities or governments or countries did not engage with survivors. And the first one was they were worried it would re-traumatize survivors. We'll talk about that. Our panelists will talk about that. I have to say my experience from the feedback we've gotten that survivors haven't had that experience, but actually have had the opposite, actually felt really empowered as being a part of this process. But there are things you can set in place that are listed in the guidance document to really try and mitigate any re-traumatization for survivors. And then the second thing is a lot of people just said, well, that sounds great, but I don't have any idea about like what steps I should take or what I should do. And that's really how we designed this guidance document, is really to think about the concrete, practical elements of all of this. So we also just want to say this guidance document addresses two particular types of ways to consult or engage with survivors. It's really focuses on focus group discussions and individual interviews. We know that there are other ways to engage with survivors, for example, through a prevalence survey or an online survey, or, there's a whole bunch of different ways you can do it. But we really are sort of talking about two particular methodologies in our guide. So I'm not going to read through these because some of our panelists are going to talk about this, but we will send this information to you ahead of time. But we also just want to say is that there's a whole bunch of different reasons why you should consult with survivors. But overall, just in terms of our philosophy, is that our experiences, survivors have needs. And then the government institutions create their institutions and their intervention. And the reality is there's almost always a gap between what survivors and the diverse survivors need and what an institution or government provides. What we hope, why you should consult with survivors, is to work to lessen the gap between what survivors actually need and with what government institutions provide. And just a quick example of that, having done a lot of international work, we'll work with a lot of countries or communities or counties who will be really proud about the work they've made to better coordinate. I mean, in some places we go and say, we're finally talking to each other. That's a really big deal, right? And that's great, and we fully support that. But what we want to know is, how is what you're doing meeting the needs of survivors? So in the guidance document, we're not going to go over these. I'm referencing these to you. What you'll find about what we call some of the safety and ethical considerations is that you have to have informed consent with survivors. So we only have survivors who volunteer or want to be a part of these processes with us. We have to address the confidentiality that survivors come and bring to us. We also have to address that we need to compensate not just survivors, but any survivor organizations that we partner with. So for example, with Amithani's organization in Minneapolis, because they work to recruit survivors we were focusing on women survivors' experience with the police in Minneapolis. So, we worked with them and coordinated with them. They spent, a fair amount of time just recruiting survivors to be a part of that. So they deserve money for that too. So compensation is not just to the survivors who come, but also to the organizations who help to recruit survivors. We also need to think about having a private space for this, so that there's survivors feel like they're in a comfortable space where they have privacy. And then also thinking about whether or not you'll record survivors' consultations and what you'll do with any transcript. So we recently had an example in a country where we had done focus group with survivors. We just worked right now to develop the themes from that. And one of the lead government people on that project sent an email to us and said, I want to see the transcripts from all those survivor focus groups. Well, because we did not get the permission of the survivors and we did not tell the survivors we're going to do that, we just respectfully declined that request, because we really have to abide with our agreements with survivors about what we'll do with the information that they tell us. So this just says a little bit as an example. We have lots of examples in the guidance to think about, well, which survivors should I have participate in these? Well, in short, it depends what your focus is, right? What's the purpose of your focus group or interviews? Here's an example of, in this community, they wanted to know why survivors have not reported the violence they experienced to the police. So in this example, that was kind of the purpose. We wanted to understand that. We obviously had to look for survivors who did not make reports. That's a particular group of survivors. We also wanted to have survivors from all across the geographic areas. We wanted to make sure we had representation of marginalized communities and marginalized survivors as a part of it. And then we also wanted a variety of ages. And we said, of course, that we were only working with adults. And just to be clear that we're talking about engaging with survivors as adults as a part of this process. You'll see some things in the guidance document about the size of the focus groups. Generally, we say 8 to 10. Sometimes when we've had 8 to 10, when Laura and I just did one, we decided because the information was so rich before, we actually divided them up, and instead of co-facilitating, we ended up having 2 groups of 4 to 5 because we wanted to get some more depth about what we wanted to learn. And we generally say no longer than up to 2 hours in length, because we are asking survivors to take times out of their life. And we generally find that that's about the right amount of time, is no longer than 2 hours. But you can find more information about this in the guidance. When we have lots of details in the guidance document about how to recruit survivors, about all the ways that you'll do that. Mostly we're saying to partner with survivor or women's organizations in shelters or crisis centers or other organizations to recruit survivors. You want to think about how you'll say you're recruiting. In some communities we've worked, we've been more broad and said women's health study, and it'll include asking about the violence that helps the safety and privacy of survivors in case others might find out where they're going. But We provide some script, like a sample script in the guidance document about, when you're reaching out to survivors, what to say and how you can sort of go about doing that. So you'll find that in there as well. We feel really strongly about the need to compensate survivors. So if you're doing them in person, their transportation to your focus group or interview, childcare if needed, providing financial, either cash or a gift card to a local store of some sort. And then also, of course, to provide food and beverage for survivors. A lot of times we'll end up doing one over the dinner hour. And so you don't want to have survivors coming and not have some sort of food or beverage there as well. Sometimes you can be in a situation where your funder may have issue with you giving direct money to other people. So some of the ways that we've worked around that is to say it's to compensate for the transportation costs or the cost to get there. And so if you are applying to a funder, you have to make sure that you're within their guidelines, of course, about how to do this. Laura wrote quite a really helpful section in the guidance document about how to think about how to do remote survivor consultations, meaning on Zoom or by phone. We learned a lot by doing that. Laura and I had done a few of those now, and it was really helpful to actually do them in practice. We learned about how to think about the safety considerations and the privacy. So, when you're select a space, how private it is. Well, if you don't live there and you're not working there, you have to have a team that's on site who can help make sure to, give out the consent forms, address the privacy and the location for all of these. So we have a whole section about how to think if you end up doing these on Zoom or by phone or WhatsApp through video call, about how to think about this. And then to think about how to support survivors after a consultation. We provide you with examples of what to say, what to watch for, about how to partner up with survivor organizations so that if any traumatic experiences do come up, about how they can process those, and about how to identify available resources in advance to doing this work. So that's really important as well. We're going to talk with you a little bit at the end about how to think about, so it's one sort of goal in work to collect the information. It's a whole other process then to think about what do we do with the information that we collected, and how do we incorporate that into our systemic advocacy work or creating an intervention that helps survivors. So we have some examples of some sample reports and how to think about identifying themes from those, about who should be reading the transcripts, who should have access to them. So our panelists are going to talk about some examples of that today from their real life experiences in doing this, but we want to just point that this is also in the guidance document. And then about what you're going to put in the report, we have a sample report for you to look at that we have done about how to think about writing them, what to include in terms of demographic information, how to sort of lay out the question of what it is that you are exploring. And our panelists will talk about this with you as well. So the last, I just want to talk about, a lot of people often want to know, if we're not able to get survivors together, how about if we just do a focus group with a survivor organization or a women's organization and interview them or do focus groups with them? And we would say, absolutely, you should. That when you think about the people who have the most contact with survivors in a confidential setting, it's often shelters, crisis centers, women's organizations. What we don't want you to do, though, if you can, is we don't want you to replace that with doing actual interviews or focus groups with survivors. We think this should be in addition to and not in replacement of talking with survivors directly. So I'm going to stop there. Just gave you sort of the big picture overview of what you can find in the guidance document. But now Laura's going to go to our panelists and have them sort of talk about some of their experiences. And as they're talking, you're welcome to put thoughts and comments in the chat or in the Q&A part of the webinar.
Thanks so much, Melissa. That gives us such good grounding, both introducing people to the guidance document and some of the themes that might resonate with them for questions, participants for questions, and also our panelists for experiences they may want to share. So really appreciate that. So now to our panel. I'd like you to each talk about this question at the top, which really has kind of 3 parts to it. Describing your experience with consulting with survivors and focus groups interviews, the importance of it, what you found to be important and through an example or in general, and then how you've actually conducted them, you know, some practical aspects that you've seen. So I'd like to start with you, Amrithani. Would you be willing to kick us off?
Yeah, absolutely. So maybe I'll share at DAP, we've done listening sessions with a variety of groups. We've done listening sessions to conduct need assessments around community-based responses to domestic violence, to assess victim survivors' experiences of accessing human service systems. As Melissa said, to look at police response and victims' experiences contacting and engaging with justice systems. We've also done listening sessions with folks that use violence, specifically men of color and providers of color, to talk about how to create more cultural responsivity within our own programs. And we've also done listening sessions around access to justice within the family court system and participated in listening sessions as advocates. So lots of different ways that we've engaged with this type of model. I think the importance of it is that it's a way for us to give and create opportunities for empowerment and for our victim survivors to be able to use their own voice and have a direct line of connection to folks that are creating change within systems that have historically oppressed them or not really helped them feel like they had a lot of agency within those systems, specifically some of the projects that Global Rights for Women have been working on. I think it's also a way for us as an organization to be able to engage in our own accountability around the way that we work and the way that we also might perpetuate harm or not provide services that are accessible or are really serving the victims in the way that they're needing from us as a community-based agency. I think too, for victim survivors, and in my experience specifically with some of the groups that we were able to do with Melissa, it was beautiful to be able to see victim survivors who were maybe historically isolated or came to us for advocacy services and didn't really have connection with other survivors, be able to be part of a collective process and be able to move through their experience and talk about similarities and differences that they've gone through individually, but be able to do that in a group. And for us, we were able to watch people in front of us move from their experience of victimhood to being a survivor, to feeling the confidence and the empowerment to advocate for themselves and for other people. And often it led to longer relationships with those folks and supporting them in using their voice in other platforms that had a lot of opportunity for engaging in larger macro level changes. So I think for us, there were just lots and lots of benefits, both for the people that we were working with, but also for us as an organization and the way that we functioned. And then as far as how we conducted them, we really looked at feedback that we were getting often from our participants, and then we keep track of their contact information, worked with our teams to talk about what questions we might have, what kind of change we were hoping to make within our own organization, and then would craft questions that we wanted to come up with, think about our structure, and then sent solicited feedback from our participants, maybe over a survey, and then ask them if they were willing to participate in an actual listening session. And I think we're going to go into more about the process later, but that's a little bit about how we did it at DAP.
Thanks so much, Marthini. That's great. I'd like to now move to Scott Miller with the Domestic Abuse Intervention Programs. I know you've had a lot of experience consulting survivors, Scott. So if you could address these 3 points, that would be great.
Yeah. So, for those of you who heard about the Duluth model, I mean, at its very core is developing responses, shifting the way that systems respond based on the voices of survivors, right? So you're taking their experience with that system when they intersect with it, whether they're voluntarily or involuntarily intersecting with it, and finding out, okay, so when that system intersects with your life, what are the things that it does that works, right? Because we don't want that to end. And then what are the things that don't work? What are the things that undermine your safety or undermine your quality of life? And then if you could redesign that system to meet the needs that you have, what would you change? And why would you change them, right? So it's really just core. For example, when COVID first hit, and in-person groups, men's groups were not really possible at that point. For an organization that really starts with survivor experience, we were feeling like we were in a room and we didn't know the light switch was. I mean, it was just, we didn't know what to do in an unprecedented situation that wouldn't cause more harm if we were contacting these individuals electronically. So before we basically made individual phone calls with the men while we connected with survivors on the phone to talk to them individually about their experience or their thoughts about what we were going to try to do and what we should account for, which gave us a lot more confidence going forward about how we were unfolding our online group. So we were one of the last programs, I think, in the country to go online, but because we were spending time trying to figure out the safest way to do it, which is the goal of all of our interventions, right? So the importance of it is can't be overstated as far as how important that work is to understand how to navigate system change. There was a question in the chat that came up about when would you intersect with victims of sexual assault in a focus group setting. I think I'm capturing the question. If I'm not, please correct it. But I'll give you an example. One of the things we were finding on our particular state law in Minnesota is that a domestic violence survivor who calls 911 doesn't have a say in whether or not the offender gets arrested. If there is probable cause that a crime has occurred, then the state will take that individual into custody. But if that individual sexually assaults his partner and the case is a sexual assault case, she gets to choose. So when you look at the sexual assault laws in our state, there's a gap, right? Because they're designed less for intimate partner sexual assault and more for other kinds of sexual assault that occur in our communities. So we wanted to hear from women about what their perception was around this particular gap. And what that was confusing to them is, you mean he can punch me in the face, he can break my arm, and I don't have a say in anything, but then all of a sudden he rapes me and I have all the say in the world? Like, why don't you treat the rape like you treat everything else? Why do I have to be put on the spot to deal with him and be the one responsible for putting him into all of this trouble, right? I mean, so that was an example, right? Where we were trying to understand this gap. We saw it, but we didn't know how it lived on the ground in survivors' lives. So that was a example of where we would bring that. And those were less focus groups and more individual interviews, just because of the traumatic nature of that particular form of violence. Most women decided to do those on an individual basis. How have you done that in the organization? We partner with our advocate partners in our communities, and and basically kind of hone down who's the group of women that we need to talk to about a particular problem, right? So if it's probation, we want survivors whose partners have been on probation. And I'll give you an example. We were in a community, not in Minnesota, but one of the interesting things is that one of the themes that arose when we were listening to these women tell their stories is that most of them, what they knew about what was happening or not happening was coming from the offender. There was nobody in the system who was really, they were connecting with to find out like what's happening with him. Is his rehab going well? Has he been suspended from his men's program? They didn't know. And really what they knew was from him. So there's an example where a woman saying, I went over to drop off the kids at his house, and I put some food for the kids in the fridge, and there was a bunch of alcohol in there. And I thought, well, so I said to him, hey, I didn't think you were supposed to be drinking because you're on probation. And he said, well, my agent sees it, and he didn't care. And I said, so how do you know that the agent doesn't care? She said, well, because he told me so, right? And that just the theme over and over and over again, right? And so in that community, one of the big gaps was there's survivors don't know what's going on, and the only one telling them anything are the offenders, which is it's all fiction. So so that's the kind of thing that you would never get doing a ride along, that you would never get reading a police file or a prosecution file. These are the things that you derive talking directly with the survivors. One more quick example: 911. I knew what their policy was. I read it, right? But now we have a community with a lot of group homes, and so a woman would call on a domestic assault from the caregiver who is operating the group home, right? Not their intimate partner, but their caregiver. And they'd call 911 and report an assault. And 911 had developed this practice, not in policy, that they'd call the group home back to see if it was true and who were they talking to? The person who was alleged to have made the assault, right? Again, there's no other way we would have learned that had we not spoken directly with survivors. So once you do what we're all going to be talking about here, you just find that there's really no confident way to move forward with any kind of system change effort without directly speaking with survivors.
Thanks so much, Scott. Good, interesting examples. Alicia Wallace of Equality Bahamas, can I invite you to answer those same 3 points?
Sure. At Equality Bahamas, we are really, really focused on centering survivors in everything we do. So we're really careful about not making ourselves the experts or convincing ourselves that we know everything because we've heard all these stories and we've read all of the statistics and we're engaged in this work on an ongoing basis. And it can be difficult to do if you're not really intentional about it, separating yourself from the knowledge that you think you have. And one of the reasons that it's really important to engage survivors in interviews and in focus groups is to dig a little bit deeper into the what. So we kind of have the what's already. We have the stats. We know these, 1 in 3 women. We know that it takes a certain number of times for a woman to leave before she can actually safely stay out of an abusive relationship and things like this. But where is the why? And we can guess at them all day. There are all kinds of myths and a lot of it is victim blaming. So how can we actually find out the reason behind some of this? Why aren't as many people reporting as are experiencing violence? Why is that happening? What is making it difficult to report? What is making it uncomfortable? What is making survivors feel that it is either unnecessary or ineffective? If we're looking at leaving, what makes it difficult to leave? What kind of support system do we need to ensure that people are actually able to leave and to actually be safe when they do leave? So that leads us to, the purpose of this work. We want to find out why so that we can figure out how to fix it. What do laws and policies and programs and services that work look like? And again, we can think about all of our theories and what we studied in university and what we've read in newspapers and lots of scholarly articles. But the true experts are the people who are having these experiences and who are making these decisions because they're forced to every day. Survivors are the experts. So we have to create spaces where they can come and they can teach us. And we have to go in with that approach that we are learning from someone and not that we are there to pathologize or to give diagnoses to survivors. One of the most recent experiences that we had was doing a pretty large project that got put off a couple of times because of COVID-19. It was originally planned to have these interviews take place door to door in a way very similar to the way that the Bahamas does the census. And of course, with COVID-19, we weren't able to do that. So we kept putting it off until we realized that the pandemic wasn't really going anywhere. And we decided to switch to a digital or a virtual mode of doing this. And we talked about Zoom and things like that. But of course, there are internet challenges. Everyone doesn't have the internet. But most people, the vast majority of people in the Bahamas have a cell phone. So we settled on using phones, which meant that we had to kind of backpedal a little bit and get back to our training with the people who are actually administering the survey, who were conducting the interview, to ensure that they had the skills necessary to do this by phone, because it's quite different doing an interview face-to-face than it is to do it, not being able to see the person, not being able to read their body language, missing out on little subtle cues, not seeing what's going on within the environment. If there's a child that needs attention, if a perpetrator has entered the space. So we had to talk about things like safe words and how to use them and how to respond if a survivor uses a safe word. So, not just going quiet and not getting nervous or talking aimlessly, but coming up with a plan with the survivor that they could play along with if something like that happened. We also had to make sure that survivors felt safe and that they felt that they were talking to someone who would keep confidentiality. And that's difficult to do on the phone. It's somebody calling you up who tells you their first name and what they're doing. How do you trust that person that they will receive this information and not share it with anyone else? So ensuring that we only asked the respondents for their first name and didn't ask for any other identifying information. When we did the focus groups, it was quite interesting. Anytime we do focus groups, I'm always kind of unsure of how it's going to go because we are such a small country. All of our islands are pretty small and we have very small communities and people tend to just know each other from church or, it's the person down the street's grandson and everyone knows who's married to who. So we had to be attentive to who is entering the room and how people respond to each other, recognizing that a person who is committed to participating in the focus group and who might be looking forward to the compensation might not come to us and say, I feel uncomfortable because that person used to be married to my ex-husband's cousin, and I don't really want to share this information in the same space. So we had to kind of pay attention to see what the body language was like, how people were responding to each other in that space to make sure that we could really have a real conversation and that people wouldn't be holding back. So a big part of this process starts at the very beginning with building trust and ensuring that people know that they can be open, that they can share information, that they can say as little or as much as they want, and that there would be no judgment in the space. But again, I really want to stress that it is just so important to remember that these interviews, these focus groups are a lot less about the what than they are about the why and the how and about building something. So Scott mentioned the question about why would you do this? When would you engage survivors? For so many different reasons, to find out why things are the way they are, what responses are like and why, what we can do to change them and how we can develop something that's better. There is prevention work to be done, there's intervention work to be done, but really critical is the support of survivors from the time that they experience violence to when they make the report to building their lives after.
Thanks so much, Alicia. We do have people contributing in the chat. I really, really appreciate that. We want to move next in a moment here to developing the themes, kind of how we use the information we gather. But I wonder first, Melissa, I could toss this to you. There's a question, some real concrete ones about addressing language barriers and the use of interpreters. And if you could start with that one, that would be great. Maybe we can weave the other ones in.
Yeah, so we have worked with interpreters for a number of the focus groups that we have done. And one of the things I'll just say is a couple of things to think about when you use interpreters. Of course, it depends if it's consecutive or simultaneous. So you have to think about it in terms of planning time, right? So if it's consecutive interpretation, you know, you're going to have to really hone in on your questions and just know it's going to take much longer in terms of the transferring of the information. The other thing that we had an experience of is we had an interpreter who had never heard survivors speak about their stories before. And actually the interpreter became traumatized and emotionally broke down during the focus group. She'd never been in a space to listen to survivors talk about this sort of experience before. And she just said, I just have to have a break. Because she said, I mean, she just literally had tears coming down her face. And so one of the lessons we sort of learned is about understanding if interpreters have had the experience. You know, for those of us who do it a lot or have done it for many years, we forget when, you know, people haven't before. And of course, what, you know, an interpreter wouldn't have necessarily. So we have had that experience. And so it's something to think about as well.
Well, Melissa, what I've noticed you started incorporating because of that is talking to the interpreters in advance, right?
Yeah.
These are the kinds of things you'll hear. Do you have experience with that? Will you need a break? Are there vocabulary or words we might be using? Some of that preparatory stuff I've seen you do works well. I also wanted, the second part of your question, Aslam, I want to turn to Amrithani and see if she would talk about her experience about kind of where survivors were in the process and their experiences, and you know, just briefly some of the considerations that you've dealt with, Amrithani.
Can I add something about interpreters as well?
Sure, absolutely.
I think one other thing from working with interpreters a lot is also to be really clear about how you want them to interpret, that you want them to interpret everything that you're saying as the person asking the question and everything that any of the participants say, so that they're not summarizing or interpreting for you, because you can lose a lot of really important information that way. So that's just one other thing I would add. As far as the second question, I would say that in the listening sessions that we've done, people have been all over the spectrum in their experience. We've had folks that came in and were just at the beginning of their advocacy process, but had a lot of experiences and really wanted to be able to share them. And we've usually shared our solicitation for listening sessions with everyone so that we're not filtering people out. We'll then check in with them to make sure that like a group is a good place and a good way for them to engage in the listening sessions or in focus groups. We've also had folks that had gone through a process, had gone through their own healing journey, and maybe had been separated from their partner for a really long period of time, folks that had gone all the way through a really long court process and were on the other side of their domestic violence experience. And we found it really helpful actually to have a mixture of folks in our focus groups, just because as far as like the mutual aid and the healing component of it, it was really helpful for victim survivors to be able to hear, learn, and listen to each other's stories.
Thank you, Amrithani. So as we move forward here in thinking, we've gathered the information to the point of the guidance and some of what many of you have said, we've had a focus, a reason why we're doing the inquiry around depending on what we want to know. How then do we move that into developing themes and write reports to include those voices and, you know, get that in front of people to hopefully change policy and practice in the direction that we hope. Scott, can I turn to you first?
Sure. Well, the process that we would use normally is that we would record these. We would build money into making sure that these could be transcribed. And then as they get transcribed, they get redacted. And then once we have the raw transcript of the focus group, then we collect advocates together to read them independently, and then come together at a meeting and talk about and agree to the themes that we pulled out of the focus group. And when we, like, for example, say we have 10 themes that we've agreed upon that are things that were coming up in different ways. Like the example I gave earlier, one of the themes about not having any contact with the system or knowing what's going on with their ex-partner on probation. We'll take that as the theme, but then we'll extract quotes, not long quotes that people can be identified, but quotes to give that theme context for the next reader. So one of the quotes I remember us pulling out was a woman who said, you know, when you don't know where he's living, when you don't know if he's being supervised, when you don't know anything about him, it's like living in a horror movie. You never know when he's going to pop up. He's going to pop up at my car at the grocery store. He's going to pop up in the parking lot when I get off of work. I'm constantly on edge because nobody's talking to me and I don't know what's going on, right? So that would be an example of to put that theme in context, and we'd have 2, 3, 4, sometimes 10 of those, depending upon how strong that particular theme is, so that the next reader, whoever that might be, and in this case it would be probation, they can see what the downhill result is of that behavior of not getting in contact with survivors. So once we get those themes put together, then we put another report, as I said, the theme and then the quotes, and then the demographics and all the different, the numbers of women that were had gone through the focus groups, and then that report becomes something that we use with the government agencies that they're about. Now, one of the things we don't do quite intentionally is that, you know, in a focus group on the criminal justice system, we're going to get conversations about 911, we're going to our emergency calls, we're going to get conversations about law enforcement, prosecution, probation, the courts, jail, all kinds of different entities. We don't share the entire report with every agency. We really extract. So if we're going to sit down and talk to probation about how to reform what they're doing, we're taking just the aspect of it that is about probation and bringing that to them, so that we don't create more difficulty in trying to organize the system. So we really break those reports up so they're system specific, and then deal with those systems on an individual basis with the outcomes. Once we do that, right, and we start working on reform, and then we implement it, now we wait 4, 6, 8 months, and we go back and we do another set of focus groups with women who've been subject to the new response. And we see if we can verify if we've actually accomplished what we were trying to do. And inevitably, we have to tweak things that are unintended, that we did not realize, right? An example would be prosecutors wanting, one of the defense strategies was to discredit the survivor's statement to law enforcement by saying that she was intoxicated or she was drunk or she was unable to testify to the officer in a way that was credible, and really diminishing her her voice in the process. So prosecutors wanted law enforcement to ask the question, have you been drinking? Okay, how much? 2 beers. Can you follow my questions? Yes. Are you able to answer these questions truthfully? Yes, I was. And that just kind of takes that whole strategy off the table. Well, one of the things that ended up happening, and we learned down the line, is that there were women, mostly indigenous women, who were being asked that question by law enforcement up front, like one of the first questions that were being asked. And when they heard that, it was like, you know what? We're done. If that's what you think, then we're done. We're not going to have a conversation. It just shut them down. So we had to go back after learning that in the focus groups to law enforcement and say, okay, there's a way in which that question appears when you have to ask it, and it has to appear towards the end, and you have to give the question context, right? So that survivors understand why you're asking that question, not just that you ask the question, right? So those are examples where, I mean, anytime you're trying to take survivor experience and build it into a system response, you have to have a method of going back to see if it actually it worked, right? And because you don't want to make things worse, you want to improve the access or the way a system takes up this particular problem, and you won't know it if you don't follow through with the post focus group conversation. So I think
Excellent. Thank you.
There.
Thanks for those examples, Scott. Alicia, can I turn to you now for your sense of compiling themes and what has worked for you in communicating the results of hearing from survivors, and maybe also what some challenges that you faced are?
Yeah, I think that the instinct is to look for common themes. And of course, that's something that we do. It's something that's important to do in any kind of research, particularly where you're getting people's experiences. But one of the things that I also like to do is to look for the less frequent and the more surprising sharings from people, the ones that aren't being repeated over and over again, because the low frequency doesn't mean that they're not important or that they're not happening, but usually is an indication of a particular experience of people who are sitting at particular intersections. So someone who is perhaps getting a low income and a migrant person and living with someone who is abusing particular substances. So you have less people who are represented in the interviews and in the focus groups, but this could be a phenomenon that's happening in particular communities or with people with particular identities and consistently being overlooked because there's only 1 person out of 10 or 3 people out of 20 who are talking about having this particular experience. So I like to look for those little outliers and see what they might mean. I also make it a point to look at relationships between themes. Sometimes you can find some cause and effect, and sometimes you can find that 2 themes seem to sort of go hand in hand, if not all the time, most of the time. So we can look, for example, at the way that money functions in relationships where there's abuse. So you can have this, I think most of the time we talk about situations where the woman might not be working or isn't earning as much money and is really dependent on the abusive person's income. But there are also situations where the woman is making more money, but her money is still being controlled by someone else. And if you add a layer onto that, like substance abuse, or what we call in the Bahamas sweethearting, which is, cheating on a person and money being spent outside of the household, this can cause some complications that can exacerbate violence that's being experienced in the home. So looking at relationships between those things. And then when it comes to integrating it into our work and ensuring that, the work really is survivor-centered, because it's our interventions and our advocacy is coming from that place, there are a couple of questions that I think that we need to ask ourselves. So we ask, what did I not know before we went through this process, before we talked to people? What in this pile of information is new to us? Because if it's not new, it means that we probably haven't been addressing it in the work that we've done so far. What did we get wrong? What are some possible mistakes that we've made, and how can we correct those mistakes? Where has a missing piece of knowledge, where could that have caused harm? Where does it have the potential to cause more harm if we're not careful about integrating this new learning into the work that we're doing? And then to kind of check yourself to see if this work is really being responsive to the information that we're getting and to the guidance that we're getting from survivors who are the experts. Thinking about what changes would be made, what would our work look like to ensure that the survivors who spent their time with us and shared their stories with us feel like it was worth their time talking to us. What could we present to them that they would say, oh yeah, it was worth it. It was worth it taking the bus, taking 2 buses and coming and sitting there and feeling kind of uncomfortable for a few minutes until I got to know the other people around the table. What would make it worthwhile? And so just having these questions to guide what we're doing, but also to go back and check to make sure that we really are doing what we committed to doing when we started the work and when we got the commitments of survivors to participate in the process with us.
Thanks, Alicia. Appreciate that. Melissa, can I toss to you now?
Yeah, I think I'll just give just a quick example of an experience we had in community or country who they worked really hard to make some really big policy changes in their response. This was a criminal justice agency, and they had just spent literally an entire year to change their policy and do a lot of training. And we had done focus groups with survivors about this criminal justice agency. So survivors who had intersected and reached out to this agency in this particular country. And it's almost a little bit even hard to describe the energy in the room with this particular group of survivors. They had a lot to say. They were mad. They were pissed off, to be a little frank. They used the word corruption more than once about this government criminal justice agency, and had really strong feelings and notions about not only did this criminal justice agency they weren't helpful, they actually felt like they did more harm. And that was sort of overwhelmingly what the survivors had said. So having that experience with this group of survivors and then going to this criminal justice agency and talking to them about them, we expected them to be defensive, but they were really defensive. About the leadership in particular was about the work. They said, we just did all this work and how can that be? And I remember one of the leaders just said, well, I'm sure that you just talked to survivors who had their interaction with us prior to this training and prior to this policy change. I said, I actually know because we asked them to tell us when this happened. So I'm happy to go back and look. And so we did just out of curiosity. And the experience was that all of the survivors had experience with this criminal justice agency after they had this big policy change and after this criminal justice agency had the training. So this was really hard for the leadership to reconcile. And so I think one of the things and what we've sort of learned by doing a lot of coordinated community response work is that we're not here to say that training's not important. It is. We understand that. But what we also know is that if we don't develop a response that continually monitors and evaluates and have systems of accountability within departments to make sure that the practices and the thinking from that training are actually happening in the department and that the policies are actually being implemented as intended, this is just a good example of how you can still have this sort of response by survivors. So doing training and changing policies isn't enough. And it's kind of the big things that when we look back over the last 40 years, even in the US, we've seen this over and over and over again, that this is not enough. And so, we had to spend a lot of time with the leadership. The other thing that the leadership in this country wanted to do is, we had a prior agreement that the focus group report would be available, to learn it and look at. And he didn't want us to put it in writing, right? And so we said, well, but we have an agreement with survivors that we're going to put this in writing. And so that's what we're going to stick with, is our agreement with survivors. And we will put, we're going to honor this. We're not going to not honor what survivors said because, you don't like what they had to say about your agency. So just using that, I think, as an example of what you can run up to. And this hasn't happened every time. I'm just using an example of a time where this did happen.
Thanks, Melissa. Anthony, as we come to you, I'd also like you to maybe, in addition to adding your experience with, what's been successful, what challenges as things get compiled, maybe talk also a little bit about, whether somebody does it individually, how you, talk with others about kind of distilling themes to sort of account for the context and understanding, right? Given what we've said about how rich and varied survivor experience might be. Is it a solo project? Is it one you do in collaboration as you put those themes together?
Yeah, thank you for that. I would say maybe I'll answer that first. I think we've definitely done a lot of our looking at themes as a collective, myself and the other person that was listening and in all of the listening sessions. Similar to what Scott and Melissa and Alicia, we also try to take that back to our attendees so that they can look at what we've written, make sure that we're capturing themes and their perspective intentionally. What we've done is, so far, we've shared individually, like sent it to them for them to look over and then respond to us if there's things that they have concerns about or any feedback that they might have. We haven't gotten that whole group of people back together to talk about their experiences again. But that's definitely something we would be open to doing. And I think the group that we've worked with would be excited about that because they really liked meeting together. And we saw a lot of idea generation coming from them working collectively. And so I think there's a lot of benefit to that. Let me know if that didn't answer your question, Laura. I think as far as other things that I can share about my experience maybe is how we used the information, because a lot of what we did is really similar to what everyone has shared. I think we were able to really make a lot of innovative changes as an organization as a result of the conversation and the themes and the information that was shared. Some of the information from one of the listening sessions that we're putting together is going to go to a group that's helping create recommendations to our city around their budget and how they're going to try to move away from policing systems to community-based resources. And they will then have information about what victims have identified as being really important for them to have in community. We were able to use some of this information to really help guide our 3-year organizational strategic plan. It was helpful for me to be able to go to my board and say, hey, we have spoken with this many survivors in our programs and in community, and this is what they think about racial justice. This is what they think about how white supremacy exists in our program structures. This is what they think about who they want us to partner with and how they want us to show up in community. And so what are we going to do about that? And how are we going to reallocate our resources internally to be able to meet the needs of the people that we have historically served and are currently serving right now? It's also been useful to, one of the listening sessions we did was with folks that use violence. And we met with individuals that had completed our program successfully, with providers that had facilitated both at our organization and across the nation. And then we also interviewed individuals that did not successfully complete our program and had been kicked out or dropped for some reason. And we asked them, what do we need to do to be more culturally responsive? What would you have wanted to learn about? What topics were we not talking about that we should be talking about? And it helped create more buy-in around creating that change in our program. So we could go back to our participants and say, hey, we're going to add these topics because we talked with this group of people and they said they wanted to hear about this, and made it more of a collective change process within our organization. And lastly, it helped us apply for funding so that we could provide resources that we hadn't historically offered. And so as a result of some of our listening sessions, we got funding to do BIPOC specific programming. And we also were able to get funding to pilot a community-based response to domestic violence outside of our traditional advocacy services that are really focused on providing legal support within the judicial system. And so lots of amazing different ways that we've been able to utilize our clients' experiences and lift up their voices that really have shifted the structure and the focus and the financial resources of our organization.
Oh, great. Thank you, Anthony. Those are really powerful examples of making good use of the time we bring people together and the listening. So thank you for that. Now we want to move to in our final 10-15 minutes, lessons learned and any final thoughts and comments. What I might say is there is a question that maybe somebody could take up about, any lessons learned about how we might invite survivors who have different kinds of experiences with violence, different experiences with different kinds of violence, and whether we group them or have them in separate groups. That's one option. You may have other lessons learned, but maybe pick your top one or two and any final thoughts and comments you have, and hopefully we'll have some time for additional questions at the end. I would invite participants, if you have questions, to go ahead and put them in the chat at this time. So Alicia, can I start with you? Any lessons learned, final thought? Yeah,
I think one of the most important things that I learned is, and I talk about this all the time, and I've probably said it already, is to take off the expert hat, just shed all of the things that I already know and enter the interview or the focus group from a place of curiosity. And yes, recognizing that the people that I'm listening to know what they're talking about and they know what they need. And what I need is to understand their experience and how we can help to push for exactly what they need in response to what they've experienced. And that being more important, that curiosity being more important than confidence. And that's really what survivors want to see from us anyway. They don't want to see confidence necessarily. They want to see curiosity, that we have questions that we genuinely want answers to. So going in thinking about not getting confirmation for anything, but maybe complicating what we know or what we think we know, delving a little bit deeper into what we already know and questioning some of the information and statistics that we have, making the best possible use of the qualitative data that we're collecting in listening to their stories and their perspectives and their thoughts about what they have experienced. And that leads me to think about the difference between probing and leading with our engagement with the survivors. So sometimes we go in wanting or really feeling like we need to get a particular piece of information because we know that we want to put something in a policy. We know that we want to put a recommendation forward, resisting that urge and not asking leading questions to compromise the work that we're doing, but making the questions more general so that survivors have room to kind of take it where they want, and then probing further where it's possible to do that. So asking them to share a little bit more about something or to explain what they meant by something and to take away our own assumptions. And then the other thing is recognizing that there's a lot of power in being able to own a narrative, being able to change a narrative. So in many cases, survivors will come in and you can see, Melissa talked about this, body language and everything changing, because it is a scary thing to share your story. But for many of them, when they do share and when they get to hear other people share their stories and they are actually listened to and they can feel that and they can see that, And if we've successfully created this space where everyone feels hopeful that this is going to move towards something better and we're going to create a better future, then they actually leave feeling truly empowered. And I mean that not in the way that empowerment gets thrown around all the time, but they leave feeling truly empowered, like they have taken something back and that something good is going to come from their sharing of their experience.
Thanks, Alicia. A lot of rich thoughts there. I know I'd love to keep talking about, and as with all panelists, but thank you for those final comments. Melissa, can I turn to you as well?
Yeah, I think just a couple other things just to add from what Alicia was saying is one of the things that's happened just as a lesson learned is that while survivors may come because they've been selected because of a particular interaction or a particular purpose, we've also found that in a number of focus groups or interviews that survivors sometimes are telling you things that they've never told anyone before. And this was, I remember the first time this came out, I was a little surprised by this, that, you know, this is the place, but they felt comfortable enough and they wanted to be able to share that. So that I think is a lesson learned, to just know that, and that can happen. So an example would be, as we were talking with a survivor about her experience with a government agency as a victim of domestic violence. And we ended up talking about her children. And then she ended up talking, she said, I've never told anyone that I'm a victim of childhood sexual abuse, but I am. And I can't even, you know, believe I'm telling you this, but this is part of my life. I feel compelled. I want you to know that. And I'm just reflecting on that right now. And so we had a couple of experiences where that's come up as well. I think the other thing is just that the number of survivors that you're going to plan for, in my experience, has never been the number that actually come. So in my experience, if you invite 8, you could plan on either 4 or 12. We've had more experiences than we didn't plan for, where a number of survivors brought a friend or a sister to come. They didn't tell us ahead of time, but they did. And of course, we allowed them to come in. So you also have to be really flexible and not sort of only have 8 chairs out if you think you're going to have 8 survivors. In my experience, it's never ended up to be the exact number of survivors who have confirmed that they were coming. I think then lastly, I'll just say is that, you know, having worked with Scott and Duluth in a number of places, someone asked a question recently and said, can you talk about an intervention in Duluth that did not go well, that or that really just needed a lot of work, and say a little bit about why? And
How much time do you have?
Yeah, right. Exactly. Well, so the example that I thought of right away and we've talked about is a time where we followed the funding as opposed to talking to survivors first. And that was, there was a time frame here in the US, and I know this happens around the world too, where there was a lot of money for what are called family justice centers, or in the international world through UNFPA, one-stop crisis centers. So in Duluth, what we did not take the time to ask survivors is this something you want? Is this something that would be helpful to you? We followed the money first. And what ended up happening is that we had a notion of what it should look like. We didn't ask survivors what it should look like or what it should be included. And all I can tell you is that today, what it started out with, and I remember when it made the news, this new shiny building and so much money and time and resources, versus what it is today is very different, because now it is what survivors said they actually wanted. So, you know, it was an example and a lessons learned I'd like just to share in terms of following the money, about what money was available versus what was it that survivors actually wanted.
Thanks, Melissa. And Anthony, what are your lessons learned and final thoughts?
Yeah, I think I would say food is healing and a wonderful way to build community. And so I would strongly recommend having food at your focus groups. And think about the environment, maybe have music, think about the lighting, think about where are you holding it far away? Are you holding it where the community is? I would also agree to be flexible and be patient. Just because you never know what's going to happen. And it might be that someone needs to come and be in that space, and they might not say a whole lot, and then they might need another invitation to come back, because maybe one-on-one is better than group for them, or they're still trying to establish trust. I think being open, like Alicia was saying, I know for us with some of the listening sessions, we found out that so many of our survivors were criminalized survivors, and following their lead and really giving them the space to talk helped us learn so much more about what they were experiencing. And as Melissa said, that they hadn't shared before. I think one of my biggest learning pieces is also, you learn well when you make mistakes. And I think one of the biggest mistakes I've made is not being really clear with the providers that are showing up to facilitate or have a role in the listening session about what their role is. So my quick example is doing a listening session with a historically oppressed group, and the person that was there to take notes, we weren't recording it, so note taking was really important. And that person was so invested in the conversation and had their own lived experience that instead of writing, they kept interjecting their own experience because they were really identifying with the other participants of the group. But it led to a lack of documentation of what we were there to learn about. And it really broke trust with some of the participants who didn't feel like they had the space to actually use their voice. So being really clear, what's your role? What does it mean to show up in this space? And then checking in afterwards to see whether that person needs to be able to process and talk about their experience as a provider or a listener or note taker.
Great, thank you. Thank you so much. And Scott, what are your lessons learned, or maybe your top two, because our time is brief, and any final thoughts?
Sure. Well, one is that the humility, I think, as Alicia has pointed out. I remember sitting down, we have a domestic abuse no contact law in Minnesota, and it doesn't provide any communication to victims if it gets put in place. So we wanted to make sure that they were informed and had a method of intersecting with that decision before it was made. So we were going to put it on the victim rights card, with our law enforcement has to give by law to every survivor at the scene that they respond to. And so I had written up with another advocate what a brilliant way of communicating it. So we brought it to our women's advisory group and we gave it to them and said, what do you think? And I remember a woman picking it up and she literally threw it back. And she said, yeah, I wouldn't read that. And I said, well, I think it covers everything. What seems to be and she said, well, Scott, it's 2:30 in the morning. My husband just got taken into custody. My kids are upset. I work at a job that I don't get vacation, and you want me to read a 2-sided document? It's not going to happen, And I said, okay, so would you be willing to take this as a group and work on it and figure out a way to say this that you would read it? And a few weeks later, they brought it back, and it was about a third as long. And now every victim right card that gets put out in Duluth to a survivor is the Danko information is written by survivors for survivors, right? There's no way we could have written that as well as they did. So that's, again, coming in as willing to learn and to be curious and humble, right? No matter how long you've been doing the work, you don't know. The other piece is that when you're reading focus group notes for system change, for example, survivors can articulate clearly what the problem is, but they can't tell you why it's a problem. Now, often they'll have an attitude about the government agency that's responding, right? They're sloppy. They don't care. That's a big one. They don't care. They don't care. They don't care. But when you take that, I mean, as somebody doing the organizing, those problems are real. I got to figure out why it's one, right? So an example would be the example I gave earlier about probation not contacting survivors and letting them know what's going on. That's real, right? The advocates believed it was because they didn't care. The survivors really didn't care, but I don't find that very often. So when I started looking into it, it was actually a policy issue within probation about how many times you have to try to call a survivor. And there were agents that were making 3 calls within an hour instead of 3 calls. Like they had to call 3 times to try and get a hold, but they were doing it within an hour because their caseloads were heavy and they had to get things processed and they couldn't stack up on their desks. And so they had this dilemma, and this is the way they tried to get through it. And so working with the supervisor to change that, like you can't just say try 3 times and let it go. Clearly, right? There needs to be more direction on how that contact happens and how important it is to the ability to supervise that individual. So it's just a caution that there's going to be a lot of emotion and there's going to be a lot of anger in those groups, and for good reason, right? But the solution is not going back to the system and blaming them or thinking that they don't care, right? The assumption that we always make is that people get up in the morning to do the best job they can, and we need to figure out what is getting in the way of that, right? What is the gap? And it's usually a systemic one. So I don't know if the screen changed because that's like the music at the award shows. That's getting me off, or
A little bit.
I'll stop.
And that bookends the curiosity so nicely, right? Bringing in that spirit of curiosity as we hear from survivors, and then taking that into, well, what could be driving what that experience is, so that we can hopefully be the most effective we can be. I want to, our time is really up, and I know we tried to get to as many questions as we possibly could. We will be sending out a link. I want to just wrap us up here and thank all of our panelists for talking with us today, and those of you participating from around the world for taking time out to join us. I also want to thank my GRW colleague, Sophia Morissette, for ensuring everything, all the technical parts and bits went smoothly. We've included links in the chat to learn more. Of course, if you'd like to support our work at Global Rights for Women, we do invite contributions to support that work and include and promote our partnerships with, as you see here, people around the world. We center survivor voices as a means to achieving systemic change. If you have questions that just absolutely we did not get to, I know a number of you are doing very compelling work, as you've written about in the chat. Do feel free to reach back and reach out. We try and spread and share information as best we can. Thank you all for your hard work. Thank you again to the panelists. And that concludes our session for today.